So again, good morning. My name is Leanne Foster. I am a provider outreach and education specialist here at WPS Government Health Administrators, and I would like to welcome you to our webinar on provider enrollment for ordering and referring only providers. I'll start with our disclaimer. So the material presented today is accurate as of today. As you all know, Medicare changes often, so I'm going to encourage you to please make sure you're always reviewing official CMS communications, including the CMS and WPS GHA websites for the most up-to-date CMS rules and regulations. As I answer questions today, I will be using current CMS rules and regulations, and that is what was used to develop the material for today's presentation, along with questions that you submitted during our registration process. I want to thank you if you submitted a pre-submitted question. Those questions really do help us for finalize our material and make sure that we're meeting your needs and expectations for the session. So thank you for sending those in. As I mentioned, we are recording this session, and we will take a look at that recording, and barring any technical issues with that recording, it will be made available to you on our YouTube channel as soon as possible after today's session. Also, immediately, it will be available on our training page on our WPS-GHA website, where you would be able to access that encore without necessarily accessing YouTube if that's a challenge in your organization. But that recording is going to allow you to view it again if there's something you missed, something you want to see again, or you could share that with anyone who was not able to attend but might find the information presented today useful. So on our agenda today, we are going to focus on providers who are not going to be billing Medicare directly, and we'll talk about why that may be, but they are eligible to order and refer for Medicare services to providers that will be billing to Medicare directly. So during this session, we'll help you understand the basics of why a provider would enroll purely to order and refer services and who can enroll to order and refer only. We'll also cover the process that's involved to enroll for ordering and referring, or that also includes certification of services using the CMS 855-0 application. And this is an abbreviated application that we'll walk through today. I'll also provide you with some tips that'll help you avoid any development when you're submitting that application, any delays, or maybe any unintended actions when you're submitting to order and refer only. I'd like to start with an overview of when someone may need to enroll to order and refer only. There are going to be times where a Medicare beneficiary is going to see their provider and then they're referred for another type of service. Now, they could be seeing a provider who's also going to bill for that, say, office visit, and maybe they're being referred for another service. So some examples of services that typically require an ordering and referring provider to be identified on a claim include clinical lab services, imaging services. MRIs are one of the things that come to mind, as obviously a beneficiary is not going to walk in and say, hey, I'd like an MRI today. They're being ordered or referred for that particular service. We'll also see referrals for durable medical equipment. While WPS as a MAC is not necessarily going to pay for that durable medical equipment because we are not that DME MAC contractor, that MAC contractor is going to need information about the provider that ordered or referred for that particular piece of equipment. The same goes for home health services and hospice. And this is the home health services and hospice is sometimes where you get into that certification. But it's the same scenario as far as that provider's ordering and referring information on a claim. Now, if a provider is enrolling to order and refer only, it's a little bit different. They're not going to bill Medicare. They're seeing the patient, but for a multitude of reasons, which we will cover in a few minutes, they are not going to bill Medicare for their service. But again, as I stated, they are going to refer that beneficiary or that patient to a provider for a service that will be billed to Medicare and requires that information regarding that ordering and referring provider. So here's how that goes. So services are going to be billed to Medicare, the services that were provided as part of that order or that referral. Okay, so that service is going to come in. That claim is going to potentially, likely, again, I'll use the example of the MRI. Again, a patient's not going to walk in and just say, I want an MRI today. There's generally that order or referral that is required for that. So when that MRI goes through our system, the system's going to be looking for, was this ordered or referred by an eligible provider? And it's going to be looking for the name of that provider as well as their National Provider Identifier, or NPI. And then also on the claim, it's going to be looking for the performing provider information. And this is normal process in the claims world, where you have to indicate the rendering or the performing provider with their name and their NPI. In most cases, what we oftentimes find is that most providers are set up to do this if they are enrolled in Medicare to bill. So to be eligible to appear on a Medicare claim as an ordering and referring or certifying provider, that provider must have an active record in the provider enrollment chain and ownership system, also known as PACOS. PACOS is the system of record for all provider enrollment information. If you have any experience with provider enrollment, which I'm sure many, if not all of you here do today, you understand that PACOS is building our claims adjudication system. If you have claims issues, if something is not in the claims system, maybe it's an address, maybe it's a specialty that's not reported correctly or hasn't been updated, you first have to submit an application which updates the PACOS system. That PACOS system extracts information into our claims adjudication system. We do not make updates to that information directly into those claims systems. So to get a provider's NPI into the system so that they can appear on claims as the ordering referring physician, they either need to have an active provider transaction access number. So if they have an active PTAN, so that is also known as a PTAN, it comes along with their NPI. And that NPI is tied to that PTAN and it's in the system. So if that provider orders or refers for a service, when the claim comes in for that service, they will list that provider's NPI and it's in the system attached to a PTAN. You won't have any problems. You're all set. Claims are going to go through. That is the majority of scenarios. The other option is that a provider would have a valid opt-out affidavit on file with us in PACOS. And this is a provider who is opting out of Medicare. They're seeing patients, but they're entering into private contracts and they're not going to be billing. However, even though they're not going to be billing Medicare as part of their opt-out, which we're not going to focus on in this webinar, but just for background, that opt-out provider is added into PACOS as someone with a valid opt-out so that we have their information on file and their NPI will go into our claims adjudication system. So if they are ordering and referring for services, that NPI is in the system and it will adjudicate. The focus for today, though, is for providers who don't have a PTAN and they don't have a valid opt-out affidavit on file. They purely just need their NPI added into PACOS so that it extracts to that claims adjudication system so that providers that are rendering the services that they are ordering or referring for are able to process in our system. So how do we do that? If someone needs to order and refer services only, they are not going to bill Medicare directly, and there are some reasons for that, and we're going to talk about that in a minute. the situations where you might need to fill out an 855-0. They are going to enroll into our system, but again, they're not going to be assigned a PTAN because they are not going to be billing for services. Really, they're adding their MPI to PACOS for informational purposes only. One thing I want to call out here as well, if a provider is enrolled to order and refer only, it's essentially a national enrollment. What do I mean by that? What that means is if a provider has had their MPI added to PACOS, let's just say in our jurisdictional state of Michigan, they are set up, their MPI is in the claims adjudication system in a screen that is shared nationally with all MACs. So what that means is if a provider is enrolled to order and refer only in one jurisdictional state, they do not need to enroll to order and refer only in any other jurisdictional state that they may be ordering and referring only in. And that is because, again, they're not submitting claims. They're not being issued a PTAN. We need their MPI on file. And to reduce provider burden, CMS has made that particular claims screen where the adjudication process will reference, it is made that national. Okay, so you won't need to, if you have a provider that is ordering and referring for services in 5 states, you don't have to submit an 855-0 for all 5 states. Keeps it simple. By the same token, if your provider is enrolled to bill, they can order and refer in any state. They would only need to enroll separately if they're going to bill in multiple states. So the scenarios where this may happen. Certain organizations are going to be reimbursed by federal funds in another way. And their services are likely going to be covered in full. And so they are not actually eligible to bill Medicare. Situations where this happens, a provider could be working for the Department of Veteran Affairs. They could be working for the Department of Defense, so that would be a TRICARE type situation. It could be that they're working for a public health service or an Indian health service or tribal organization. Those are the more common situations where we see it. A lot of times there are residents involved as well that maybe are working for an entity that's not part of a medical education program that's funded by the federal government. We also sometimes see it with federally qualified health centers and rural health clinics. These are not as common, but when there are providers practicing for these organizations and because of how they're funded, they may not be billing Medicare directly, but they might be ordering or referring someone outside of their organization. This happens a lot with maybe smaller VA hospitals as well. Perhaps there's a service that hospital or that clinic doesn't provide. They refer the patient outside of their organization, but it's something that's going to require that MPI to be on the claim. That is a situation where the provider may consider enrolling to order and refer only. Sometimes providers will enroll to order and refer only because of their specialty. We see this with pediatricians and dentists. Sometimes they just may not be billing Medicare or need to bill Medicare. And they're, again, referring a patient outside of their organization that is going to be a service that's going to be billed to Medicare and they're ordering and referring. But I want to be clear here. Pediatricians and dentists are eligible to enroll in Medicare to bill directly. It just depends on the situation. This is simply a listing of eligible scenarios where a provider might need to enroll to order and refer. From an eligibility standpoint, it's really not all that different at the provider level than it is for a provider that is going to enroll to bill Medicare directly and is going to request to be assigned a PTAN. So the provider needs to have a National Provider Identifier, an NPI. Obviously, that's what we're trying to get set up in the PACOS system. And so we need to have that information. They have to be eligible to order and refer services. So essentially this is going to include all of your physician specialties, and this includes residents and fellows. They are going to need to be fully licensed though. So essentially they are providers that, again, could bill Medicare directly. They meet all of those qualifications. They're just in a work environment where they're not going to be billing Medicare directly. It does also include some non-physicians, and this is where that gets a little bit gray. So for non-physicians, there's only a handful of them that can order and refer. Physician assistants, nurse practitioners, clinical psychologists, clinical nurse specialists, and certified nurse specialists. And I'm going to show you where that information is because it can be updated from time to time. So there's a couple of places you can look. First, on the CMS website, I'm just at cms.gov. And under Medicare, I'm going to go to Enrollment and Renewal. And there I'm going to go to Providers and Suppliers. This brings you to the CMS, basically provider enrollment page. A lot of great information out here about provider enrollment. And under the Medicare supplier for providers and suppliers, you are going to see an ordering and certifying page. On this page, it is going to talk about when a provider would need to order and refer, but it's also going to have an eligibility list out here. So you must be one of these specialties. Now, it's interns and residents, they're having them fall under that non-physician piece. Okay, but usually, again, your interns and residents, those are going to be MDs and DOs, but they're still in that training program. But if your provider's specialty is not listed here, or their provider type is not listed here, they wouldn't be eligible to order and refer only. And then you'd have to look at whether or not the provider is eligible to enroll in Medicare. So you'll run into ineligible Medicare specialty or ineligible specialties. So such as you're going to see, massage therapists, things of that nature. You'll notice that chiropractor is not on this list. These are not providers that are eligible for that order and referring. The other place that I'd like to take you out to is on our website, and I will be providing the links to these in the resources section of the material today. So on our page, underneath Topic Center, underneath Provider Enrollment, and I'm just going to scroll down. There is a whole section on Order Refer. Only has the one article, so very easy to find. And this is an article available to you, has the same information as far as eligibility requirement. It also talks about opting out, which we talked about, and the different work scenarios. It also has links to, and we're going to go into the application here in a minute, it has links to the internet-based application that is on PACOS and the paper CMS 8550. So all in one place for you. So it is our first spot for questions. So I'm going to check in with Bailey. Bailey, do we have any questions in the chat?
We have not had any yet.
All right. Well, we will check it again with questions all. So please throw those questions as you have them in the chat so that we can get those answered for you. Thank you, Bailey. So next we're going to take a look at the process for enrolling for ordering and referring. So at this point, you've determined that your provider doesn't have a PTAN, doesn't have a valid opt-out affidavit, isn't going to request a PTAN because they're maybe in a scenario where they are not going to be billing Medicare directly. So we want to move forward with that 855 O application. So let's look through that. As I just mentioned on the website, you do have a couple of submission options. One is to submit the application electronically through the PACO system. The other is to submit the CMS 855-0. Now, as always, if you've attended one of my webinars, I am going to encourage you to enroll electronically through the PACO system. This has a lot of advantages. One of them is processing time. An electronic application, if it requires no development, processes within 15 days, and a paper application processes within 30. That longer time has a lot to do with the fact that that paper application needs to be mailed to us. It then needs to be scanned, ingested into our workload system, and there's a lot of automations in PACOS as far as verifications that we can't take advantage of with a paper application. If you've never submitted through PACOS, I just want to pause there for a second. If you've never submitted through PACOS, I encourage you to also look at our YouTube channel. We did do earlier this year, there was a webinar on PACOS basics to help you navigate getting a user ID and a password, helping you starting an application just in a general sense. Those could be very helpful to you. So I encourage you to take a look at that. Just consider setting that up, but if you have any questions, those are available to you. Before I go into the section by section completion of that 855-0, I am going to start with the questionnaire process in PACOS because this is a little bit different. Typically, if you've submitted an 855 application in PACOS, or even if you haven't, when you go to submit, there's going to be a lot of similarities in how that application is set up. It's going to look and feel different, but it's asking you a lot of the same questions that the paper application would. In PACOS, it's going to be slightly different because it is an abbreviated process. So here, what you're looking at on the left is the PACOS questionnaire where you can indicate that you are an eligible ordering, certifying, and prescribing physicians and other professionals. That is going to be the selection from that questionnaire that is going to take you down the path of the CMS 855-0. It's very important that you're selecting that circle, that radio button is what we call them, because if you don't, you are potentially going to have to start over. What happens after you select that and click on the next page button at the bottom, it is going to give you an alert. And that's what you're looking at on the right. On the right side is the alert. It's telling you that you're being navigated to something called the easy enrollment process for a CMS 855-0. And if you've filled out other 855 applications in PACOS, you're going to notice the difference here. Normally it would take you to, okay, let's pick states, let's do all of that good stuff. Here it's taking you to a streamlined application. What CMS has done with PACOS is created this easy enrollment application, if you will, that is the O, and it strips out some of the more complex information that is needed if we're asking for a PTAN. So the provider's not billing. It removes practice location. It doesn't ask, the 855-0 doesn't ask about reassignment information. It wouldn't ask about electronic funds transfer information because none of that's needed because the provider's not going to bill. Those are all related to how we calculate payment, where we're sending that payment, so it's not needed. This reduces provider burden. It makes it quicker to fill out. However, you will notice that a lot of the sections as we go through this are going to be very similar to the 855I. So it's just, again, a streamlined version of that form. It is also going to ask you if you're currently enrolled, and I'll show you that in a minute. Again, it's looking to see if your MPI is already in PACOS and if it can leverage some of that information. So let's look at that. The very next thing, if you continue to this, it's taking you to that easy form. You really can't turn back from this. If you need to, oh, I actually need to do a different kind of form, you will need to start over if you actually need to do that 855I. So then on this screen, the system is going to look to see if your provider is already set up in PACOS with a PTAN, with an opt-out affidavit to see if your MPI is already on file. And it's looking for active records. And if it finds one, this is what it'll look like if it finds one. It'll show you the contractor, the app type, the specialty type. Now, mind you, ordering and referring, chiropractors aren't eligible, but in this example, the provider its data it's pulling just happens to be for a chiropractor. So that is okay. It is asking you if you'd like the system to auto-populate the information from that enrollment record. By selecting that circle, that radio button, it will then save a lot of data entry for you. There's a caveat to this though. You can either be enrolled in the system or enrolled to order and refer. You can't be both. You can't have a PTAN and a separate enrollment to order and refer only at the same time. Remember, we talked about if you're enrolled with a PTAN anywhere in the PACO system, if it's active, your MPI is available to all MACs as an eligible ordering and referring provider. And you're also able to bill in whatever jurisdictional state that you're billing in. If you submit an 855-0 and you have a PTAN, it is then going to ask you if you want to convert your existing, in this case, 855I enrollment to an 855-0 enrollment. You can say yes or no. If you say yes, what that's going to do on the MAC side is it's going to tell the MAC, hey, they want to change from having a PTAN to ordering and referring only. That will trigger the MAC to take the appropriate actions to deactivate the PTANs that are currently active in PACOS and replace it with an ordering and referring record only. So again, I always say you're in or you're out. You're either actively billing Medicare or you're not, and you're ordering and referring only. So be really careful about that. Now the MACs are really good about looking at this, and sometimes if necessary, if something doesn't look quite right, they'll actually reach out and ask, hey, you actually want us to deactivate this. So you providers will look to see if the provider has, because providers can submit an application to deactivate their existing PTAN. That's completely acceptable. But to reduce provider burden, there's also a process in place where if you are actively enrolled and an 855-0 application is submitted, MACs will communicate and deactivate the active enrollments because that 855-0 came in. So just be very certain as you're submitting an 855-0 that your provider isn't enrolled somewhere actively in the Medicare program. Again, as I stated before, if they are actively enrolled to bill in any state, they are able to order and refer without having to enroll in separate states. So keep that in mind. So next we'll go through the sections. Couple of things here. To be fully transparent, the sections may not present themselves in the exact same order in PACOS that I'm presenting today. I am showing a side-by-side comparison of the electronic sections on the left and the paper section on the right so that you can see the similarities and what that's going to translate to in PACOS. And I went with organizing it for flow, the order of the paper application. So if you don't see it in exactly the same order here, that is okay. You will get all of the questions. You just may get them in a slightly different order. They are asking for the same thing as we're presenting here today. This first section is basic information. So on the left, you're looking at PACOS. And one thing you're going to notice, it's not going to ask you for the reason for submission. What we just went through with that questionnaire, selecting the radio button to order and refer, the enrollment check, hey, do you want to convert? It's asking you that in that questionnaire piece. It's not asking you that in what is presented as an application section. So in PACOS, it's just going to ask you the reason you're enrolling to order and refer. And if you look at that list, you'll notice the reasons that we talked about before as far as the providers employed by the VA, a public health service. Maybe it's a TRICARE situation with the Department of Defense. It talks about residents, it talks about dentists. It's going to give you all of those same options, as you will see on the paper section 1 on the right. There you will see, are you enrolling for the first time? Are you making a change? Are you withdrawing and now maybe you want a PTAN? You will be asked those questions in the paper. And then the reason, you'll see there's group 1 and group 2. That's a little more clearly identified on the paper application. So group 1 is going to be you're employed by one of these organizations. Group 2 is going to be you're something outside of one of those organizations, and that's where you'll see the residents, pediatricians, dentists that we talked about. Other and specify. So typically this is something that we will cross-check to see if does that actually fit into one of the other sections, and maybe it just was overlooked. We can work with that. If you select other and don't specify, we are going to develop what is your other situation that's precipitating you to enroll with an 855-0 as ordering and referring only. And then there are times where you'll put a reason in. It may take a little bit more review. We might need to run that past CMS. It doesn't necessarily mean it's not going to be allowed. It's just might cause a slight delay, probably not a major one, but other is just something that will tend to have to get clarified. We don't see a whole lot of those, but that's what that is. Section 2 is for identifying information. And again, you're going to see similarities to the CMS 855I if you are actually requesting a PTAN. On the left, you're seeing the section as it's presented to you in PACOS, and on the right, you're seeing how it's presented to you in the paper application. And the type of information that we ask here, we still need all that base of the provider's name, other name if they have it, social security number, date of birth. We're going to ask about a PTAN. This is going to be one of the things PACOS will know, but on the paper application, we'll be looking at to say, hey, is this provider actively enrolled? Do we need to make sure they want to deactivate that and choose to be enrolled as ordering and referring only? It does happen, but we're cautious about it, and this is where we can flag that a little bit. We do need to have the type 1 MPI for the individual because, again, the whole point to this is to get that MPI into the PACOS system. We're also going to ask about educational information, name of the institution and the grad year. The provider needs to be an eligible Medicare provider in order to enroll to order and refer only. They also need to follow those specialty lists that we talked about, again, with that abbreviated non-physician list. It's not everybody, but with MDs and DOs, it's a pretty all-encompassing list. The specialties of MDs and DOs, all of them are included in that. But they need to be eligible. So this isn't where you'd be able to enroll somebody that isn't eligible to normally bill Medicare. It's just, again, they don't need that PTAN. Section 2 continues to ask for licensure, certification, and DEA information, or that Drug Enforcement Agency information. So the license is going to prove that they are eligible to be ordering and referring. Again, same requirements as an MD needs an MD license, whether they're billing Medicare or whether they're ordering and referring only. It's going to ask for national certifications. That would come more into play with, say, your physician assistants and your nurse practitioners that need that certification to be eligible for Medicare. And then the Drug Enforcement Agency registration information. This is something that if it's provided, I do encourage you to submit a copy of that certification for verification. All of this information, the license, the certification, and the DEA certificate, do need to be verified. A DEA certificate, because of the challenges with the source validation with the actual DEA, sometimes you may run into development for a copy of that certificate when it's disclosed on that application. So something to be aware of. The other thing that you'll notice is on the left in PACOS, these questions are spread across multiple topics or pages inside PACOS, and that's what that's representing there. But it is asking for that same information. This is also an instance where you may not get the questions in the exact same order that we're presenting them today. But again, you do get that same information. In PACOS, you can add multiple if you need to, just by continuing to add active information. And then on the paper application, if there's more than one, you'd copy the page and fill it out for each one. Typically, there's not a lot of need for that, but sometimes with certifications, we see that. The next section is section 3, the final adverse legal action. The provider's not billing Medicare. We're not assigning a PTAN, but they are referring to providers who will be billing Medicare for a service. So we need to still assess any risk to the Medicare Trust Fund. So you will be asked if there are any final adverse legal actions that have been imposed against the applicant. In the paper application, it is going to provide the information on the page. You see that on the right of the types of things that we're looking for. We're looking for convictions. And typically they're looking for felonies, they're looking for misdemeanor convictions that are generally healthcare related. We're looking for all of that. In PACOS, there is a link there where it says for more information, view, and that's a link that gives you the same list on the paper application. Just it's been hidden a little bit just for making the interface a little bit more user-friendly. But we still need to have that. Yes or no. If you answer no, that's it, you're done. If you answer yes, if there is something, you do have to provide the legal action that was taken, the date and whom it was taken by. In PACOS, you're not seeing that now. If you select yes and hit save, it is going to activate additional fields for you to provide that information. Next is the specialty section. On the right, you're going to notice that it's going to be in with the identifying information section. So again, this is where it will be. It's going to appear in a different order than on the paper, but again, asking all of the same information. The primary medical specialty, you'll see here, there's physician, there's MD/DOs, there's also the non-physician specialties that are eligible. I'm showing you a partial list because I'd have to scroll down. On the right, you can see the entire list, and that's on that paper application. Again, showing all of the medical specialties, and then that abbreviated non-physician specialty listing. Undefined, that is something that we are going to have to assess and review when it comes in. Sometimes, if you check on undefined and include a specialty, it could again be a specialty that was maybe missed or overlooked on that list, especially with physicians, it's quite a list. If we identify that it does correlate, then we're fine and we can make that call. However, if you are indicating a specialty that is not eligible, say you are here, you'll see that mental health counselors are not on this list for ordering and referring. That is something that's going to take further review and could result in denial of that ordering and referring only enrollment piece, simply because it's not been identified as a specialty that can enroll simply to order and refer. And I mentioned mental health counselors. I do want to be clear, mental health counselors can enroll for a PTAN to bill Medicare. So not everyone who can bill Medicare is eligible to order and refer only is all. The next section is correspondence address. We do still need this. This is the thing that if we see a change on an 855-0, this is what the change typically is. It's either this or the contact person. So we need this information should we need to reach out to the provider about anything. We don't necessarily have a set of what that is, but in the event that CMS needs us to send out some type of communication to ordering referring providers, we had a lot of that happen during the pandemic, and we will need an address where we can reach that provider. So it can be a PO box or a street address. There's no requirement here for it to absolutely be a street address. Again, this is for general correspondence questions, anything that has to go out to that provider. We will ask for a phone number and a fax. The fax is optional. We will ask for an email. A lot of our correspondence does actually get sent out via email. Again, just depends on what the directive is and what that correspondence is pertaining to. Section 6 is the contact person. This is the same as any other CMS 855 application. This is who we are going to be able to reach out to should we have questions on the CMS 855-0 application. Are we maybe needing that DEA certificate? Is there a missing field? Do we have questions if they checked other and gave us a specification that we need more information about development? This is the person that's going to receive that development and also the notification that the enrollment's been completed. Again, not receiving that PTAN, but just basic contact information. And then you get to the certification statement. So if you're in PACOS, you can sign the application either electronically or you can upload the certification statement. You can upload documentation as well. And you would see that certification statement there that you can print off, have signed, and uploaded. I do encourage everyone to sign electronically, just a little bit more streamlined, but I do also recognize that's not always the best option for every organization. So you have both options here. And then on the paper CMS 855-0, the provider needs to sign that, acknowledging it. There's no need for any type of authorized or delegated official involvement here because, again, the provider's not being paid, they're not being assigned a PTAN, and so just the provider needs to sign that. They're not reassigning benefits anywhere. They're just saying, hey, load my MPI into PACOS so that I can order and refer, please. And I mentioned that items can be uploaded. This is the documentation section and what that upload looks like in PACOS. The things we typically see here: copy of a state license, if applicable. Typically, we can verify those with source verification, but we do see those. National certificates. This is, as I mentioned, physician assistants, nurse practitioners. Sometimes we need their national certificates for enrollment. And then I talked a little bit about that drug enforcement agency certificate. If it's being reported, I encourage you to attach that just because that is the easiest way to verify that information and avoid some development there. So you will tell the system that you want to upload documents, and then you can go ahead and upload those documents. Couple of reminders here: it does need to be in a PDF or a TIFF format. PACOS does not like image files. It's not capable of ingesting picture files. So like a JPEG or a PNG, those are not files that PACOS plays well with. And if you attempt to, you'll probably see some errors. If those errors don't trigger, then you'll probably potentially see some development if there's uploaded documentation that we need that's not there. You'll also notice on this page, and I want to point this out, there is a button at this point to return to withdraw existing enrollments. So if you get to this point and you want to confirm those enrollments that you currently have, it's going to allow you to go back and see that. So you kind of have one more shot. You haven't submitted the application, so it's not going to be something that we have to process. You can back out of it at that point, but you do have that one more chance to do that, and that'll actually take you back into the normal side of PACOS, if you will, because remember, this is an easy application form. This is in its own area, uh, not outside of Pecos, but it's segregated just a little bit. So Pecos submission, this is what that is going to look like once you've uploaded documents, signatures, all of that good stuff. You are going to get a submission confirmation. The submit button will appear after those signatures are accounted for, and you will get this. I do encourage you to keep a copy of this. There's a lot of information that's going to be helpful should you need to contact provider enrollment or a customer service area. One, it's going to have the name and the MPI of the provider. It's going to have the web tracking ID, which will help the MAC find that application. It's also going to have a submission ID. We don't use that quite as much, but once in a while we have to go there. And then it's going to tell you the status of your signatures. Did you upload the signatures, or are you going to upload the signatures? That's what upload signatures pending means. The application's been submitted, but we don't have the signatures yet. Even though it's been submitted, you can still upload those signatures. Please do that as quickly as possible. That continues to be the #1 development reason for all of our applications, is that we're waiting on those pending uploaded signatures. Electronic signatures, those should attach themselves right away because, again, we don't have that delay of waiting for an authorized or delegated official. It's the provider, so it attaches right away. Before I check in with Bailey for any questions, couple of tips and reminders. First, ordering referring only is national. And I keep saying that, and that is because we do see providers send in 855-Os for every state a provider is planning to order and refer in. It's not necessary. They enroll to order and refer once, and that will allow them to order and refer nationally. So there's no need to send in multiple applications. Again, if the provider is enrolled and has an active PTAN, they do not need to enroll to order and refer only because their PTAN is on file, their MPI is also on file, and they can order and refer nationally as well. But keep in mind that PTAN has to be active. Same goes for that active opt-out affidavit. If that opt-out affidavit is active, their MPI is on file, and they don't need to send in that separate application. So keep that in mind. And confirm that your provider isn't enrolled in another state. It could be that you are finding a situation where your provider is going to order and refer. They're not enrolled in your state, or they can't enroll in your state because of their work scenario, and they haven't disclosed to you that they are enrolled in another state. That's a question, if you're not asking, it would be worth asking to find out, because if they are, they're all set. You don't have to go through that extra legwork. And here I'm leaving you with some resources. These are the websites that we went to today. So we went to the WPS Medicare enrollment of ordering and referring providers. I did also provide a couple of additional CMS websites. Chapter 10, the Program Integrity Manual, that has a lot of good information about ordering and referring. It also talks a little bit about the MACS process. And then there is the Code of Federal Regulations that talks about a lot about eligibility to order and refer. So if you need that information, you have a link to that as well. All right, I'm going to check in one more time with Bailey. Do we have any questions in the chat?
We did have one come in, and I apologize if you talked about this. I couldn't remember or not. But does an RHC submit the 855-O under the RHC NPI?
Oh, excellent question. No, you would submit the 855-0 underneath the individual's MPI. It is still all about that individual's MPI being added to PECOS. The reason they're submitting to order and refer, you would select the RHC reason. We do not actually need to have knowledge of that RHC's MPI because it won't be involved. It is all about that individual. Thank you for that question.
There's nothing else after that.
All right. And Bailey, I did see that you shared the YouTube link for, or actually I will share that. I saw a question about that YouTube link for the Pecos Basics webinar. I will get that sent out to all of the attendees so that you have that after the session. So I'll make sure you get that. Okay, that brings us towards the end of our session. I am going to invite you to please take a few minutes to complete a brief survey. Tell us what you liked, what we could do better, what topics you would like to see us provide education on in the future. Your feedback is invaluable and critical to what we do and ensuring that our education is timely and effective. We look at it, CMS looks at that. Again, we want to make navigating the Medicare program simpler for you. So there are a couple of different options depending on your preference. There's a QR code here that you can scan and it will take you to the Qualtrics system for that survey. You're also going to be, and Bailey just put that in the chat, thank you. You're receiving a survey link in the chat. You can access that as well. I'm also going to give you a pop-up. When you leave this session, you are going to see the pop-up that you see here on the slide on the right. That pop-up is simply a redirect. It's letting you know you're leaving our webinar software and you're going into the Qualtrics system for that survey. It's not a malicious site. It's not a spam. It's just making sure you know where you're going to, and it will take you right into that. So it's nothing to be concerned with. Also, in a few minutes, you are going to receive an email thanking you for attending today. Don't delete that without reading it. So this email is going to serve as your certificate if you are someone who needs credit for today's session for continuing education for your accrediting body. So on the right side, you'll see that big red circle. That's your certificate of achievement. That's going to include the date and the contact hours that you can submit to your accreditation body if you need to, or if you're doing so. If you don't get it, there's a couple of things that may have happened. One, the email comes from our messenger at webex.com. It might have gone into your junk or spam folders, just depends on your email settings. I do encourage you to consider adding that to your safe sender list. That particular email is only used when you register for a webinar and for webinars that you attend. It's not used for any kind of marketing. It's not going to clog your inbox. It's only for those events that you're involved with. The other situation that could have happened if you joined by phone, I am not going to be able to generate this email systematically. It's not going to go out to you because you weren't attached inside the session. So if you joined by phone only, in a few minutes, you are going to receive our WPSGHA education mailbox. You can email that mailbox, put the title of today's event in there, and let me know you need a certificate. Also include the phone number that you joined from. I'm going to need that to verify your attendance. Once I verify that attendance, I can manually send out a certificate if you need it. If you think of any questions that you didn't ask today, you have 7 days to send those out. So you could, so next Wednesday, and you will send those to that wps.gha education mailbox that Bailey's going to throw into the chat for you. Make sure that you put provider enrollment ordering and referring only in the subject line. That's going to ensure that that gets to me so that I can answer those questions. And like I said, you have 7 days to next Wednesday at noon to answer those. However, I do want to be clear, if it's specific about a claim or it's specific about an application in process, I don't have the access to review those. Those questions still need to go to customer service. But again, any policy questions, send those my way and I'll get those answered. So before I wrap up, I just want to check in with Bailey one more time. Do we have any questions in the chat?
Nope, nothing new.
All right, thank you. So that is the end of our presentation for today. On behalf of myself, Bailey, and everyone on the GHA Provider outreach and education team, I would like to thank you for taking the time to attend today. I look forward to your survey comments because, again, you can include future educational topics that you'd like to see. So please make sure you take a few minutes to complete that brief survey. Again, thank you very much for your time today. I hope you're well, and you may now disconnect.